Hi, this is my assessment today on the cardiac system. I will start by inspecting the chest wall, looking for bumps, lesions on the neck. I am looking for any bumps, bruises, looking for symmetry, any efforts in breathing, looking if I can see pumping of the heart or the beating of the heart right off back. I am next going to auscultate for the check the neck, inspect, and I'm going to auscultate the carotids. We have two veins, the carotid and jugular, and we listen with the bell, and there are 3 points. So at the top, mid, and lower neck for the carotids. And then after I listen, I'm listening for any bruise, a swishing or a pulsing sound. I will then palpate. I will not palpate at the top, I will palpate the middle. Use my fingers, 2 is fine. And what am I looking for is a smooth, rapid flow. 2+ is normal. Lower than 2+ or 1+ is a diminished sound. And 3+ or 4+ higher is a bounding or a hard feeling. I will now assess the jugular vein. In the jugular, we will usually have you lay at a 30 to 45 degree angle and turn. And what we will see, if there was a sign of vascular congestion or congestive heart failure, you will see a distended or a bound or bulging vein where you can actually measure it of how far it is coming out. Right now, when you do not see anything, this is a normal finding, no congestive heart failure. Now I'm going to palpate the chest wall, and what I am looking for is for a thrill. I will use the palm of my hands, and what I am looking for, like I said, is the thrill. We're looking for any turbulent blood flow that might be going on here. Next, we're going to check our pulses. We can start with our temporal pulse, and again the carotid pulse. Then we have, of course, our apical pulse. Then we will do our brachial pulse, radial pulse, ulnar pulse, femoral, popliteal, and then the 2 that we have down on our feet. I will next check heart sounds on my client. When I am listening for heart sound, it is best to remember the heart is actually upside down. So when I am listening to the lub-dub of the heart, S2, which is the dub, will be heard better at the bases, which is again on top since the heart is flipped upside down. And then S1, which is the lub, will be heard more when we come down here, or better when we come down here. So it will sound like lub-dub, lub-dub. And then down here, lub-dub, lub-dub. So we will start with the aortic, which is the second intercostal space. And we'll listen. Then we move over to the pulmonic, which is on the left second intercostal space. Again, you will hear S2 louder at the bases of the heart. And we will come down to the third intercostal space, which is, just come here, which is Erb's point for our third intercostal space. And then the tricuspid, where we will start to hear S1 loudest, is at our fourth intercostal space. And then our mitral is where we will hear S1 the loudest, as well as the apical pulse, because now we are at the apex of the heart, and this is at our fifth intercostal space. And that will conclude my assessment of the cardiac system.